Today, midwives came together in Westminster to call for more funding for the profession, to create jobs for newly qualified midwives, funded training and fairer bursaries. Their message: the UK is facing a maternity staffing crisis, yet newly trained midwives simply cannot get jobs. I went to Parliament Square to talk to those taking part. Today is International Day of the Midwife, and it takes place against a backdrop of a maternity care crisis here in the UK. Midwifery itself symptomatic of that, a profession pushed to breaking point. Many midwives, student midwives and their allies turning out in central London today to voice their concerns about the issues that's facing them. Today, not so much a cause for celebration, but a call to action. Let's speak to the organiser of today's protest, Safia Saad. Safia, really good to see you from Fund Future Midwives UK. Why is it important for everybody to come out today?
So it's really important to come out today because we are about to qualify. So I'm 3 months away from qualification and I'm not going to have a job. I'm qualifying into unemployment. This is my dream career, as it is with the hundreds of people that are going to qualify, or thousands of people that are going to qualify this year. And there is a massive shortage of jobs. We've done freedom of information requests which show really sobering numbers that many trusts in London and across England have a shortage of jobs, so they have way less jobs than the number of students that they are training, such as it is for my trust. They really want to hire me and they really want to hire the other students that are about to qualify, but there's just no funding because the government has slashed it.
And once you have a job, conditions are bleak. Midwives facing burnout. We talk about the conditions that they're facing. Talk to me about what life is like on a maternity ward.
I mean, Leah Hazard, for example, today we've submitted her petition into Downing Street and she's campaigned a lot about the working conditions of midwives. Again, review after review has stated that shortage of midwives and inadequate staffing leads to burnout and leads to women not receiving the care that they need and the care that they deserve. We are here to serve our community, we're here to serve the women and birthing people, but we're being stopped and that's why we're here today. This is my dream job and I'm being pushed out before I'm even in. Continuity of carer is the gold standard of midwifery, and this is what review has said. But for us to implement that into the maternity services, we need more midwives, and we're just not seeing that reflected.
For the general public looking at what's happening today in terms of maternity care being in crisis and midwives unable to get jobs, that doesn't add up. So what is it you want the general public to know and the government to do about it?
I want the general public to know that we are ready to serve. We complete 2,300 clinical hours. We facilitate a minimum of 40 births to qualify. We pay for our training. So like with the other degrees, it's very different. You don't qualify with a qualification. You're not trained to do a certain job. Like I did a law degree. Exactly. I did a law degree. I didn't expect to get a job as a solicitor or a barrister. I know there's training contracts for that, but I'm training for a profession. I qualify. We all qualify with really high skills, and the society is losing on these incredible midwives.
And it's not just midwives and their families suffering; it's women in midwives' care and their families too.
100%. And I think a really key point is that women's birthing conditions are midwives' working conditions. But I want nothing more than to help support families, but I'm not being allowed to do that because there are no jobs. I'm already having to consider going back into law or any other fields that I'm going to be able to get a paycheck.
Midwifery is political and midwifery is about activism. So in theory, all UK workers should be protected by the working time regulations, but what I've found is that those regulations are being really poorly and inconsistently enforced within the maternity services across the UK. They just don't go far enough, and there's no robust system of accountability or audit. And this is unsafe for midwives, and it's unsafe for the people we care for, which is the real point. We just go to work every day to keep women, birthing people and families safe. So my petition with change.org is asking for a role-specific, legally enforceable cap on midwives' working hours, exactly the same as other male-dominated safety-critical professions have, like aviation, the railways, bus coach and HGV drivers. Midwives also are responsible for keeping people safe, and we just want the same protections.
Talking to some of the women here today, they were talking a lot about the statistic that midwives work over 100,000 extra unpaid hours a week, which is a statistic that blew my mind. Essentially, maternity care being propped up by goodwill.
It's propped up by goodwill and misogyny. You know, we really don't like it when women say no. And on the whole, maternity care is a service provided mostly by women for women. So we've just kind of normalised asking midwives to go above and beyond. And we're okay with that to an extent. You know, we go into this profession because we want to care, but really not to our own detriment, not consistently, day after day, week after week, year after year, not getting breaks, working unpaid overtime, working a full day shift and then being on call and delivering care overnight into the next day. It's just inhumane and it needs to stop.
87% of midwives report burnout, that the NHS is chronically understaffed and that we could be the difference. Just a bit of funding to hire some Band 5 preceptorship midwives could be the difference between chronic understaffing and safe staffing. Safe staffing saves lives.
Been 2 months, paid for my registration, nothing. And I trained in Ipswich, had a guaranteed job there, but now I'm home, nothing. It's just frustrating. You fund a degree, but you won't fund a job.
I mean, if there's no midwives on the hospital, who's going to handle the maternity care? Who's going to look after the women? And if we're not getting jobs, that's not going to be done. And if we put in all of this work to get the degree, then why aren't we seeing that on the hospital?
And do you feel if it continues as it is, maternity will continue to be unsafe in some trusts and just get worse?
100%. If there's no midwives, who's going to look after the women? Who's going to look after the babies? It's not safe.
It's a waste because we are highly skilled professionals at the end of this course. We have our registration. We are essential for women's health and for neonatal health, and it's a waste. It is a waste of resources. It's a waste of our time if we don't go and do the job that we've trained for.
It's incredibly frustrating because we know review after review what comes up every single time is unsafe levels of staffing, and we know that there's a whole army of students that are out here. We're waiting to fill those gaps, and those spaces just aren't available for us. It's just incredibly disheartening, and it makes me feel sad to hear it constantly, knowing that we can help.
But we just want the opportunity to be able to even apply for a Band 5 job. We've worked really hard. We put in excess of 2,300 hours, placement hours, and sometimes a lot more than that. We work 12-hour shifts. Some of us are doing like in excess of 4 12-hour shifts a week. It's hard, and sometimes I do wonder that if students weren't on the shop floor in the hospitals, if these women would really get the care that they deserve, because if we weren't there, who would be picking up the pieces and doing these tasks that need to be done on a daily basis?